Hi everyone, good day. This is a live gastric sleeve surgery. We are here in Tijuana with Dr. Hidalgo. This is Hidalgo Bariatrics. Dr. Hidalgo, can you tell us what is exactly the gastric sleeve surgery?
Hi, good afternoon. I'm Dr. Hidalgo from Hidalgo Bariatrics. So basically, the gastric sleeve surgery is a bariatric surgery. So it's the most popular surgery for control the obesity. Why? Because it's a very safe surgery. The surgical time is a very short surgical time, and normally the success rate is very high. So the most of the time is recommendable for the most of the patients. Okay, even the patients with high BMI sometimes decide about the gastric sleeve surgery for reduce and then complete in second step another kind of surgery.
How can a patient know if it's a candidate for the gastric sleeve surgery?
Well, basically it's important complete the medical history, which one we have at the medical website, so that then after that we can read your medical history and we want to know more about your medical conditions. Normally the most important thing is the BMI. So the BMI, it's one of the most important criteria. The second criteria is if you have acid reflux or not. This is another important criteria. And then the third and fourth position is if you have another medical conditions like diabetes and how long time, what kind of medication you are taking for that, and basically that's the most important criteria. Okay.
How long does the surgery takes?
About 35-45 minutes. Depends.
Including the anesthesia?
Yeah, it's a general anesthesia.
And during the surgery, what are the steps?
Well, it's right now, first is the stomach dissection. We are doing that. Second is this one, vascular control. This means place a clip and just burn all the blood vessels around the stomach. Then the third step is calibrate the gastric sleeve, and then the fourth step is just complete the sleeve with the staples. Basically we use staples for remove the 80% of the stomach. This is normally the recommendations for a gastric sleeve.
So in this case, this patient has a tummy tuck. So why it is not recommended to have a plastic surgery like liposuction or tummy tuck if the patient is looking on having weight loss surgery? What is the main reason not to do it?
Well, normally we recommend have first the weight loss surgery before the plastic surgery, because we have, like this patient, we have a lot of surgeries with patients when they have a plastic surgery before and then gain weight and lose the harmony in the body. So this is the problem. If you have first the plastic surgery, then later if you gain weight, you're gonna lose the surgery, the plastic surgery, because when you gain weight, obviously you're gonna gain weight in all your body, no? I mean the neck, the arms, so the harmony in all your body gonna be lost. Quítame aquí esto. That's the main reason.
So at the moment, what are you doing?
Right now we are removing the stomach from the spleen, and this is one of the most critical steps during the surgery. It's a very solid fibrotic tissue here between the butt, but it's done.
So, Dr. Hidalgo, you mentioned about the BMI, how important it is. From what BMI it is acceptable to have the surgery?
30. This is the initial weight, which one sometimes depends in special conditions, could be a little bit low, depends. Exists another indications in special conditions, which one you could have the surgery in lower BMIs, 39, or 29, or 28.
How does the weight loss surgery helps for patients that has problems of thyroid, high blood pressure, and diabetes?
Well, overall, the metabolism is gonna change, gonna improve. So in all the ways. I mean, the thyroid function is going to improve, the sugar level is going to be much better, the blood pressure levels, the cholesterol, triglycerides. So overall, gonna improve all the body. So the metabolism is going to change and going to be more healthy. So at the same time, the patient will be losing pounds, and so going to have a physical change. Which one improve? The mood, the emotions, and at the same time improve the physical activity, because the pressure of the weight over the knees, the back, and all that just gonna be less. Okay.
So right now the anesthesiologist insert the bougie. How do you know how much stomach to remove on every patient?
Well, depends. For this reason, it's very important the medical history. Well, depends. Normally, we try to find the ideal weight, around 25 BMI. So anyway, exist patients which when they say no, I don't want to be too skinny. So in these cases, we can decide. At the end, one of the point is the medical recommendations, and obviously all the time depends the age, the patient's decision is very important, because many patients say no, doctor, just with these pounds it's enough, and that's all. So we should respect the patient's decision.
Can you explain the importance to remove the gastric fundus?
Well, in the gastric fundus, which we're going to remove, there is the obesity hormones. So the obesity hormones produce all the change and the difference. So as you know, it's very important. Understand the obesity is a disease, so it's a chemical disease. So exists a lot of chemical substances which one are running in higher levels than the normal. So this produce a change in the body, and the patients have the tendency to gain weight. So it's very important to remove this part, because there is the magic. So if the patient loses these hormones, the patient will be reduced, the hungry will be improved, the metabolism, and gonna lose the weight, and all the change and revolution is there. So right now, there is the gastric fundus. This is the gastric fundus. So it's very important to us. Remove really good. As you can see here, it's about 1 centimeter. This is just gonna remain this gastric fundus. With this is enough. Okay. So this is very important. I think it's the most important step during the gastric sleeve. We use the staples, which one is enough for the sleeve, but secondary, we reinforce the staple line for avoid bleeding, as you can see, and try to keep the correct size in the sleeve in long term. Right now also we are attaching the fat around the stomach or the sleeve. Why? Because normally before the surgery, if you remember, this fat was here, attached to the stomach. So physiologically, it's just respect the anatomy. And secondary, we prevent complications because with this fat here, we can keep this gastric sleeve in the abdominal cavity and avoid possible complications. That's the idea.
What are the recommendations after the gastric sleeve surgery, such as exercise, diet?
Just follow the post-operatory diet, and the physical activity should be as much possible. Obviously, we don't recommend the gym or weightlifting until you have at least 3 or 4 months. And basically you can have all the cardio activity during your normal life, even walk with your dogs, going to the shopping, move as much as you can in your house, in your job. So that's the recommendations, okay? And follow up the post-operatory diet. It's very important. Watch how much calories you are having after the surgery and how much weight you are losing, and we should be reach a balance and give the necessary time to the body for complete this transition. Okay, we are removing here the boogie. As you can see, this is the sleeve. But we're gonna reintroduce the boogie. Chécale. Okay, it's coming inside again. So as you can see, it's about this size. It's one finger. So this is the size right now. Okay. ¿Está? Okay, this is the gastric fundus, this is the staple line, and this is the rest of the stomach. Okay, here is where the obesity hormones is produced. Okay, here we remove it for the rest of the stomach, and this is the 80% of the stomach. It's a woman, so it's more smaller than the male. Thank you so much for watching, and follow our social media.